All right, so I'll have a quick question for you. I'll give you just 15 seconds to answer, and then I'll teach you that topic. All right, so go for it. All right, so wonderful. So 60% of you getting this correct. This is something which is quite important. अगर scientist पूछना रहा तो ये scientist पूछेंगे. Okay, so this is the most important one. If you can't remember, everybody remember Lexell. All right, remember Lars Lexell. He discovered the gamma knife. All right, so what is gamma knife? We'll talk about this, but there is a frame. All right, we use a helmet in gamma knife, which is called the Lexell frame. It is defined by the name Lexell frame. है ना? इसीलिए this scientist becomes kind of relevant. Okay, so this is why remember this, but let's just go through all of them. So very, very quickly, tell me who is Ranjan. Everybody needs to know who is Ranjan because he is the father. He is the father of the subject that we are studying because, Bhagwan to nahi, but Baap. Okay, so he's the father of radiology. He discovered X-rays on the day which, on 8th of November, 1895. All right. And is this day holding any importance because of that? Yes, it becomes the International Day of Radiology. Okay, हाँ उसने अपने wife के हाथ का X-ray लिया था accidentally. Okay, so remember 8th of November date. If you forget, it's completely acceptable. Okay, so International Day of Radiology usually has themes. All right, so 2021 का they have not released the theme yet, so it will not be asked in your exam. But last year का theme was supporting COVID-19 patients. All right, so that was about COVID, obviously. Now this year also COVID has predominated. Maybe they'll make it about mucor. It remains to be seen, but they have not yet declared. Yeah, so 8th of November 1895, and he got a Nobel Prize for this in 1901. Okay, तो ये है हमारे father of radiology. फिर आए Hounsfield and Cormack. Okay, who makes it? It's the American College of Radiology which does all of this business. Yes, they discovered CT. And do we give Hounsfield more importance than Cormack? Yes, all that measurement that we take, no, that this is this black, this is this white, that unit, very nice. That is called Hounsfield unit. So we give it a number, we make it more objective. That is Hounsfield unit, HU. Okay, so remember this. Two P's, Peter and Paul, Mansfield and Lauterberg, came and discovered MRI, magnetic resonance imaging. X-ray CT, both have the same concept based on radiographs. CT is a 3D X-ray, whereas MRI, completely different, based on magnetic field, right? It doesn't have any ionizing radiation. We use magnetic field, we use radio frequency waves. So remember at the outset, no radiation, MRI safe, makes loud noise, very annoying, right? Block and Purcell. So now MRI is a completely different technique, right? So Block and Purcell came along and discovered the, I'm writing along. I will write short forms because if I write full forms, you'll anyways not understand my writing. Okay, so NMR is nuclear magnetic resonance. I'll write this down for you. So here, what is MRI based on? So MRI is based on the concept of nuclear magnetic resonance. That can be a one-liner question that can be put to you. So remember how in our body, we have a lot of water. Do you all agree? We have a lot of matter, a lot of water. Everything has protons. Every chemical has proton in it. So all of these protons, like this pen, are revolving on its own axis. Okay, they're going round and round about themselves. Now what we do is, when I give, video is breaking for everybody or just Sachin? Everybody, is the video fine? No means it's not breaking, right? Okay. Yes, this is the first class of FMG. Okay, this is the first class. We are just starting. Okay, so the protons are revolving around their own axis. Now I'll come along and I give a magnetic field. Okay, so now पहले all of these protons are going randomly. एक नीचे घूम रहा है, एक साइड में घूम रहा है, एक यहाँ घूम रहा है. Now when I give magnetic field, all of them will align in one direction. Okay, or there will be a net movement in that direction. If magnetic field is ऊपर, net movement will be ऊपर. Okay, so this resonance which happens when they align in the same direction, and I generate a signal out of that. That movement that was generated, I generate a signal that okay, this is what is going to form the image. This concept is called nuclear magnetic resonance, right? Very cool. So this is MRI. So no radiation, just our body's protons we use and we generate signal. Okay, right. What about daughter? So funnily enough, daughter is the father. Okay, so remember daughter hai father, but kiska? Father of interventional radiology. All the procedures, all the cool parts of radiology, daughter. Henry Becquerel. Everybody knows this from +2. Yeah, He is the father of radioactivity. Okay, and he's also the father and the SI unit. Remember, ये father भी है और SI unit भी है. Okay, so he's an object and a person. All right, so remember that. Lars Lexell, very, very important. If I have to ask you one scientist, I will ask gamma knife. Okay, so he discovered gamma knife, and that is why we use a helmet called Lexell frame here. Okay, John Wild ने क्या किया? Ultrasound, right? Getting an ultrasound is so wild. Remember it that way. So he is the father of ultrasound, medical ultrasound. Yeah, and then Ian Donald comes along and says that, okay, I'm going to discover medical ultrasound, but in the obstetric field. So he's considered the father of obstetric ultrasound, right? Is this fine, everybody? So these are all the possible scientists that they can ask you. They haven't in many years, but you never know. Okay, so these are all the things that you need to remember. Okay, now going ahead to a question that has come up like a scary amount of time. So you need to know this. All right, so this is something which is important. Yeah, many fathers in radiology. VB, what is VB? All right, so cool. So all of the following investigations use ionizing radiation except. So again, something which is very, very important. So anywhere you see technetium 99, it is what? It is nuclear medicine and a different department we'll do today. But technetium 99 releases gamma rays. So is gamma rays ionizing radiation? Is it gonna ionize the matter where it passes? Yes, it will. What about hysterosalpingography? Hysterosalpingography, remember uterus, fallopian tubes, I inject contrast, I see. That also uses X-rays, right? Have you seen in the background there is a pelvic X-ray? So it uses X-ray. So X-ray also ionizing radiation. X-ray ankle, yes, ionizing radiation. What is FAST? F for, tell me, is it fast or is it focused? It is focused. A is abdomen assessment. It is assessment. S is sonography and T is trauma or technique. ये अब नया बताना पड़ रहा है. This is trauma. Okay, so focused assessment, sonography in trauma, and remember ultrasound, no ionizing radiation. So fast is our answer. No ionizing. Yes, thanks to you. No ionizing radiation. All right. So now those of you who are new here, you will be able to download the PDF. The moment the class is over, no, you can download this PDF both annotated with my kachra writing plus non-annotated. So non-annotated you can download, make up your own pretty notes and revise them. है ना? तो ऐसा कर सकते हो. Not 2 hours, 30 minutes. 30 minutes में. So the moral of the story is no ionizing radiation. Ionizing radiation, there is a whole big list. Do you want to remember that whole big list, or you want to remember chotu list of 2 things only? I want to remember chotu list. So no ionizing radiation. One is MRI. So MRI we saw very cool, generating body ka proton movement. So no ionizing radiation. It uses magnetic field. It uses radio frequency waves, right? So no ionization. Then second, ultrasound. Ultrasound uses what? It uses sound waves. Remember sound waves through which you are listening to me? Those sound waves, but not. Can you listen? When ultrasound is happening, can you listen go to the sound waves? No. These are very, what is the frequency of these sound waves? It is 2 to 20 megahertz, right? So it's very, very large. You can't, it's not in the audible range. So 2 to 20 megahertz sound waves is what we use for ultrasound, and that is why no ionizing radiation. इसके अलावा एक पुराने ज़माने में we used to do thermography. So just in case they give you that as an option, there is also something which uses infrared rays, but no ionizing radiation. Everything else will use ionizing radiation. So what all constitutes ionizing radiation? One, rays, electromagnetic spectrum. Do you guys remember velocity of light or +2 में जो पढ़ते थे उसमें से we take X-rays, we take gamma rays, we take cosmic rays. These two, fine. All the nuclear medicine scans, all the radiology scans, which is X-ray, fluoroscopy, CT, DEXA scan, I use X-ray, right? What are cosmic rays? Are they useful for diagnostic purpose? No. This is what constitutes background radiation. Remember, we'll be studying that general public also has a cutoff that you should be exposed to this much radiation. So where will they get the radiation from? It's this. Cosmic rays is the biggest source that they get their radiation from, background environmental radiation. radiation. Okay, so these are the rays from the spectrum which constitute ionizing radiation. When we talk about particles, we have alpha particles. Alpha particles are helium के nucleus. Okay, so they're very heavy. Remember that. ये बहुत मोटू particles है. Then we have beta particles or electrons. We have protons. We have neutrons. All of these are useful in radiotherapy. I don't use them for diagnosis. They are all for therapy only. All right, so this is how we divide ionizing radiation. Out of these, when I ask you which are the most penetrating rays, read the question carefully. Because one word I change in this question, your answer will change. Now tell me, which is that word if I change, your answer will change. Class is still 1, class is still 7. No, least and most is there. Okay, that answer will also change. But one more thing, if I keep it as most penetrating and I remove the part rays, all right, if I remove the part rays, then what will be my answer? Very nice. Then my answer becomes neutrons. So remember, overall, the most penetrating particle or agent is neutron. Okay, after that, if they ask you rays, it is gamma rays. All right, that is why this is a source of a big controversy since years. Since I was preparing, nobody knew what is most penetrating, and abhi tak yahi chal raha hai. Okay, so I have become student to teacher, but this is still the same. Okay, so remember, most penetrating rays. So now we draw up a table. All right, we drop 4 parts. Sachin, there'll be 4 parts of these classes every day, 6 to 7. Okay, if we need, we'll have one more. If we go at this speed at which we are currently going, we'll need one more. Okay, right. So when we talk about ionization power and linear energy transfer or damaging power, means wherever this particle goes, the damage, the dehshat that it will create around it is what we are defining. So the maximum damage is with what? Correct. It's with the heaviest one, right? So heavy particle will create dehshat all around it. But will it be able to go far? Will mota people be able to run very far? No, not really. So can I say that minimum penetrating power will also be there? It's creating a lot of dehshat around it, but not going very far. Wahin pe ghum raha hai, right? So that is why minimum will be again alpha particle. So same answer for both. Now comes maximum penetrating power. So here we remember, what do we remember? We read the question carefully. Particle पूछा, neutron. Ray पूछा, gamma rays. ठीक है? Everybody, will you remember this, right? And then when I ask you minimum damaging power किसका है? Choose gamma rays. Okay, choose gamma rays will have the minimum damaging power. All right, got it, everyone? So this is a table which can yield you 4 questions. Okay, so most ionizing is alpha, which is nothing but the helium nucleus, right? This is the helium nucleus, so it's the same thing, same answer. Got it, wasabi? All right, so this is your table. Now we go to effect of radiation. We all say na ki CT is so harmful nowadays, HRCT mat karao itna sara, right? So what are the effects? What are the damaging effects of radiation? So today, Raghav, you will love it. All right, so we'll convert hate to not love, but at least not hate. Okay, so you'll be neutral about it. So we have stochastic, we have deterministic. So English word, deterministic means it can be determined. Do you agree? Ki I can determine what is going to happen, right? I can determine that you guys hate this table. Okay, so basically what does it mean? That it is something which is predictable. Ki hoga. You give this much amount of studies, you give this table to students, they have a threshold, they will hate this table, right? So ye to hoga. It has a threshold, right? It has a threshold. If you cross that threshold, you will get hatred. All right. What is the function of dose? If you keep increasing, if you keep showing such and such tables, will the severity of hatred increase? You will have more hate, right? So the severity increases. Here, the severity of the side effect keeps increasing as the dose increases. What about the timing? Is your hatred immediate? Yes, it is immediate, right? So this is an immediate side effect. For example, erythema. So now let's convert hatred into example. So erythema. After radiation, you have erythema, right? Everything becomes red. You have seen Chernobyl. Everybody is vomiting. Everybody's become red, right? So that is something which is an immediate side effect. More the exposure, more severe the erythema, and it has a threshold, right? So erythema, sterility, loss of hair, all of these things are determinable. So this is deterministic. Exact opposite, stochastic. It is a matter of chance. कि chance की बातें आपको होगा या नहीं. इसका example याद रखो, you will not forget. Cancer. Okay, so cancer or mutations. Mutations. Is there a threshold? Ki itna radiation, you'll get cancer. No, there's no threshold. There's no threshold here. What is the function of those? But more the radiation, more is the probability that you will get cancer, isn't it? So your probability increases with the amount of radiation. Timing, is cancer immediate? Today radiation, tomorrow cancer? No. It is delayed, right? It is delayed. All right. Everybody got it? Now tell me, where does cataract figure? Chalo, logic use karo. Cataract, stochastic, deterministic. Deterministic, right? Again, something which has a threshold. We know that cataract hoga. हमने सुना है cataract होता है सबको, right? So that is again determinable. Easy? Is it easy? Right? So just remember your hatred and use that. Okay. So this is stochastic and deterministic. All right. Going ahead to one more table. So I'm increasing. I'm testing your threshold of hatred now. So tell me the unit of radiation exposure. No, Sachin, we'll do images also. Don't worry. But you want to get these one-liners correct? Tell me. You know, images are more frequently asked. I also know that. But if they give you one-liner questions, which they will, don't you want to get them correct? These are gifts, all right? So if you get these questions, they are gifts that you get wrong. So I don't want you to, reject those gifts. So इसलिए ये कर रहे हैं. Images भी करेंगे. Don't worry. कल से we'll do only images in the systemic part. Any. SI या conventional कुछ भी मिले तो choose कर लो. Okay, so this is where we have a big mix-up, all 25%. Okay, so let's come back to this. Let's come back to the question after doing this table. So इसमें क्या करना है? Again, baby steps. Okay, baby steps is, first of all, radioactivity. Is it different, guys? Do I deal with radioactivity? No, it was पुराना जमाना का रेडियोएक्टिविटी, रेडियोथेरेपी, न्यूक्लियर मेडिसिन, दे डील विथ इट. तो इसको हम एक कॉलम बना देंगे. सो रेडियोएक्टिविटी, टेल मी हु वाज फादर, व्हिच वी सेड इज अ यूनिट आल्सो. सो becquerel. Becquerel is the SI unit, and becquerel is also equal to disintegration per second. 1 becquerel equals 1 disintegration per second. C. So if conventional unit is C, can I give her as Curie? So C for C, C for Curie. This is the relation. You can remember 3.7 into 10 raised to 10. बस ये मत करना 10 raised to minus 10. Remember, females are 10 raised to 10 times ahead of males. Okay, so this is the relation between female Curie and becquerel. So 10 raised to 10 female आगे. Okay, so this is about radioactivity. Done. Now we have a X-ray. All right, so how did we learn that there is an X-ray particle or a ray which is going, it is ionizing, right? It is ionizing matter. So now when it ionizes matter, and then it strikes this person, the amount of ionization of the matter per unit mass. 1 kilogram का air लिया, how much is the ionization there? That is what is defined as exposure. That is exposure. So now using your physics knowledge, tell me, charge per unit mass, unit of charge, coulomb, and mass, kg. So can I write coulomb per kg using my physics? Yes, very smart. So this is coulomb per kg. What about conventional? So from now on, when we are dealing with radiation, can I say all the conventional units should begin with R? Yes. So that is my trick, that all conventional is either Curie or it begins with R. Okay. So now, what is the conventional unit of exposure? Is it the first thing that is happening with radiation? Yeah. So should I bring my father now? So I bring Röntgen, right? So we bring Röntgen here. So 1 Röntgen equals 2.5 into 10 raised to minus 4 coulomb per kg. You can just forget about this, all right? If you can't remember, it's okay. So this is coulomb per kg, Röntgen. Then we go to absorbed dose. Now I am coming into picture. A person is coming into picture. What is the absorption at the level of skin? Okay, this is the absorbed dose. Here we remember ABG rad. Integration, ABG rad. So absorbed ka AB, gray for SI, and rad for conventional. Okay, so just remember ABG rad. So here remember air karma is also equal to absorbed dose. All right, air karma also equal to absorbed dose. Equivalent dose, effective dose. As a relief, both have the same, all right, both have the same units. So S se remember, sievert, SI unit, sievert. And yahan pe rem, all right, we have rem. All right, so this is how we remember the units. Very, very quick revision. Shall we do with our questions? So tell me, rad. Rad is the unit of what? Rad is the unit that we are ABG rad, right? So it was ABG rad. So it is the absorbed dose. So it's the absorbed dose. And what unit is rad? It is beginning with R. So it has to be conventional, and gray is SI unit. Okay, got it? Then rem. रेम क्या है, रेम किसका यूनिट था, नीचे, राइट. सो इक्विवेलेंट डोज, effective dose. Nobody asked what is the difference between the two. So difference between equivalent and effective. When I say what is the dose which is occurring in my thyroid, in the gonads, in the intestine. So when we equalize it for the tissue, what is the effect on tissue? That is effective dose. All right. So can I say that this is the most useful representation because you are telling me that what is the effect on various organs, right? So this is the effect on tissue, that is effective dose. Got it, everyone? Difference between effective, equivalent. Yeah. Okay. What about Rongen? Rongen is the unit of what? The first thing which was happening, which was ionization, exposure that was happening, right? So exposure, Rongen. And when I say gray, ABG rad, have we already done this? So this is again absorbed. Yeah. So is this table slightly better? But I can assure you 100% you will forget this again. So this goes in choti copy. This needs to be revised one day. So take a screenshot, save it in your folder, and you do this one day before the exam. All right. So I'll keep telling you anytime there are such tables that need to be revised. Okay. All right. Now going on to next. Again, something which needs to be revised. This threshold for your hatred I am checking. Incorrect pair. All right. That is what you have to identify. So you might feel, why are we doing all theoretical stuff? I was supposed to see cool radiology images, but these are questions which have come very frequently. This is your last exam ka question, all right? So these are, don't underestimate the power of theoretical ratta maro questions, right? Yeah, the video will be available recording के साथ. हाँ, C ने साथ नहीं दिया, C तो साथ नहीं देगा ऐसे. Okay, so ARB, the maximum limits, again we have to do. So let's revisit this question again. So here we need to remember all of these values. So overall, when I talk about occupational workers, radiologists, radiographers, technicians, everybody, what is their limit? 20 millisievert per year. Over 5 years means in 5 years your total is 100 millisievert that you have gotten, cumulative pool. Every year average karke you need 20, but if I calculate in 1 year you have 30 millisievert as unit. All right, so for 5 years 100 is your limit, but ek saal mein 30. Okay, so remember any of these which is there in your option, you choose it. Both will not be there. If both are there, choose 30. Okay, so 20 and 30 millisieverts. Whereas public ka exposure, only one, remember. Okay, only one. Notes have been provided in prep ladder, they have been uploaded. Just check. Okay, aaj hi maine dekha, they have been uploaded. So this is public exposure, 1 millisievert per year. Lens, remember 150, and then you just remove 0, it is 15. All right, skin and extremities, we give a lot of room, 500, and you remove 10, 50. Now comes pregnant female. Pregnant occupational worker, 20 में से remove a 0, 2 millisievert per year. And this is the question which always comes. And public की pregnant female is same as normal public. Okay, so she has same. Now fetus, they ask you कि fetus को कितना exposure चाहिए. So remember, fetus will get आधा of mother. Mummy will take half, fetus will get half. All right, so 1 and 0.5. Okay, so now this is done. Now you will tell me. So tell me, if occupational worker is there, overall कितना चाहिए? बताओ, चलो जल्दी 2 minutes में we want to do this. Yes, so overall 20 or 30, right? Whatever is the value. General public overall बता दो per year 1 millisievert. Don't get the unit wrong. Okay, so this is millisievert. 1 millisievert per year. All right. Then when I ask you, what about the lens? What about the lens of these people? Occupational worker, very good. They have cataract ka risk 150. What about general public? 15, right? 10 ko remove kar do. What about the skin and extremities? Very nice. 500, what do you do here? You remove a 0, it becomes 50. All right, so this is done. Then I ask you, what about pregnant female? And this is the question that will come. You remember, it's not 20, I remove a 10, 2 millisieverts. General public female is same as general public, so 1. Okay, so 1, and then when I ask you fetus, this ka aadha becomes 1, this ka aadha becomes 0.5. Got it, everybody? So these values are clear to you, right? So going back to that question, just to check, public 1 millisievert, correct. Occupational worker 2, no, this has to be 20, 30. This would have been correct agar occupational pregnant pucha hota, nahi? Length of occupation 150, skin of general public 50. Got it? Everybody feeling confident? You can do this in 15 seconds now. All right, amazing. So going on to the next thing, which is the X-ray tube. Yeah, lens doses 15, no 15, it is 1 5. This is a picture from the ARB guidelines. Okay, right? So X-ray, I'll tell you. So X-ray dose, remember, is 0.02 millisieverts. All right, it's 0.02 millisieverts of a chest radiograph. But now one thing, guys, tell me, when I talk about this public exposure, am I including any CT scan that they might undergo, any X-ray that they might undergo, or this is occupation, this is background radiation? This is background. Okay, so here we don't include patients and the diagnostic studies that they undergo. All right, so वो count किया तो one कैसे रहेगा? If you undergo one CT scan, one is gone. All right, so this is not for patients, this is for background. All right, so that concept do not get wrong. Got it? Okay, so now going ahead to X-ray tube and its parts very, very quickly. So tell me this. Again, all mix up with X-ray tubes. All right, cool. So 23% of you getting it wrong. Correct. Rotating cathode is used. So remember, X-ray tube, will come back to this question. So this is how an X-ray tube appears. So it has basically one tube. All right. So there is one glass tube which is enclosed in vacuum. All right. So ये basically a glass tube है which has vacuum inside it. Okay. And then around it, what is circulating? Around it we have oil which is circulating, which will take up the heat. Okay, वो heat को लेके जाएगी. And then we have an outer tube. What is the function of outer tube? Remember, this X-ray tube is gonna produce X-rays. Do I want X-ray की आसपास के public को लगे इधर उधर? I don't want X-rays going haywire everywhere. I want them to escape through a specific part which is window. So I protect it. So this is the protective housing which is made up of lead. Very good. So this is basically made up of lead. All right. So it protects, prevents leakage of X-rays. Perfect. So now we have these parts. So this is the filament. Do you see filament? Thank you, aspirant. This is a filament like bulb ka filament. Okay. So that is called cathode. Remember from chemistry, negatively charged is cathode. Yeah. So this is made up of tungsten filament. Then we have the anode, positively charged anode, which is also made up of tungsten. But there is a difference in the alloy. We make them alloys. For that, what do we remember, guys? We remember CT is an art, right? Interpreting CT is not very easy. So CT is an art is the mnemonic, which tells you that cathode will be made up of tungsten alloyed with thorium, whereas anode will be made up of tungsten, which is alloyed with rhenium. Okay, rhenium. So this is how we have the alloys. All right. So don't need to remember. Just remember, दोनों T से स्टार्ट होता है, दोनों R से स्टार्ट होता है. Okay, so this is basically the reason of different alloy. Very good question. So Mona, basically in cathode, what do we want to do with tungsten? I want it very malleable. I want it that it can be molded into this thin filament. Okay, so that is why I'm using a different alloy. Anode pe, all of these electrons are gonna basically strike and produce a lot of heat. So here I want it to be very heat resistant. I don't want it melting, boiling. So to increase the melting boiling point, I use rhenium here. Got it? So this is the difference, right? So now when I go to this cathode here, when we heat it, all right, so here when we heat it, electrons will be released. So cathode में से electrons निकलेंगे. So what is this process called? Thermionic emission. So these electrons will be released, and where will electrons go? Being negatively charged, they go to anode. They strike the anode, and what happens? You have X-rays which are produced, but very inefficient reaction. 99% heat, 1% X-rays. So these X-rays now need to come out. So they'll come out of this window. What is this window made up of? This window is just the glass, right? It's just the glass. उसको हमने पतला कर दिया. So it is a thinned out glass. All right, it's a thinned out glass that we are taking. X-ray will be released, go through a filter. Everything needs to be filtered, right? So what is the filter? We want to filter out low energy X-ray, which are only going to cause us harm. So we use aluminium and copper. Very nice. We use aluminium copper 2.5 millimeter thickness. Okay, right. So is this clear, everybody? So cathode, tungsten plus thorium, tungsten plus rhenium, right? Very, very quickly, let's do this. X-ray tube, what is it made up of? The tube per se, it's made up of a heat resistant glass, which is the Pyrex glass.